Hello everyone, this is Isos Landa and today we're looking at an appendix. So what we have here is a normal appendix. We've got three sections here. I think I'll just pick the best section, this section right here. We'll use this section. And in appendix, we can notice it's circular. It's got a lumen. In the lumen here, we can see there's fecal material and vegetables. You can see vegetable material. And we have a mucosa. If you remember, like every GI organ, that there is a mucosa. And then deep to the mucosa, we've got a lamina propria, okay? And the epithelium on the mucosa is simple columnar. I forgot to highlight that. It's a simple columnar epithelium, and it's got crypts almost like colon tissue. And then this is the lamina propria, which is highly infested with inflammatory cells, which is normal. So these are lymphoid cells, and if you remember in the appendix, we've also got mucosa-associated lymphoid tissue, your moat, which is all this which we see here, lymphocytes. All these are lymphocytes tissue. You can see them forming nodules. This is a moat, mucosa-associated lymphoid tissue. And then deep to the lamina propria, we've got the submucosa, which is this area here. And then deep to the submucosa, we've got the muscularis propria. I forgot to show you the muscularis mucosa, which is this one here, lined by smooth muscle, a thin smooth muscle band, which is all this. And then the muscularis propria is also smooth muscle but thicker. And then you've got your nerves in between, which forms your nervous system, the part of the autonomic nervous, the enteric nervous system. Then at the outermost surface of the appendix, we have a serosa. So now, this organ is particularly prone to getting inflamed, particularly in younger patients. This is because in younger people, the appendix has a wider lumen as compared to older people. The lumen gets more closed, more narrowed. So you get to have less fecal contaminants entering in that area and inflaming the whole appendix. But anyway, it's more common in children, which is what we get an acute appendicitis, and histologically we usually tend to see neutrophils infiltrating into the muscularis submucosa, mucosa, and even here getting all the way to the serosa here, where we get to call it peritonitis. But that's just a by the way of something to know about appendix. But this here is a normal appendix, and this is how it looks like. Fairly easy organ to know. This is something you could easily pass if you're given this as a slide for your normal histology exam. Thank you very much.